Hi, everyone, and welcome to the next in a series of discussions built around the essays in the book, We in the Future, Democratic Socialism, American Style. This is the book for those who don't have it yet. You should get it if you don't. It's a brilliant book. These events are being co-hosted by the Democratic Socialists of America Fund, the New Press, and Dissent magazine. And if you missed previous events, you can check out the links in the chat box and we'll be posting them there. Tonight, our focus is on Dorothy Roberts' chapter in the book, which is on the topic of universal healthcare and racial justice. Tonight's event is co-sponsored by Physicians for a National Health Program, Left Voice, and the University of Pennsylvania Press. The panelists for tonight's discussion are Dorothy Roberts. Dorothy is the Penn Integrates Knowledge Professor and George A. Weiss University Professor of Law and Sociology at University of Pennsylvania, with joint appointments in the Departments of Africana Studies and Sociology and the Law School, where she is the inaugural Raymond Pace and Sadie Tanamasu Alexander Professor of Civil Rights. She is also founding director of the Penn Program on Race, Science, and Society. Among her many publications are Killing the Black Body, Race, Reproduction, and the Meaning of Liberty, and Fatal Invention, How Science, Politics, and Big Business Recreate Race in the 21st Century. We're also joined by Susan Rogers, President of Physicians for a National Health Program, recently retired from Stronger Hospital of Cook County, but continues as a volunteer attending hospitalist and internist there. Prior to retiring, she was co-director of medical student programs for the Department of Medicine and received numerous teaching awards from medical students and residents. She is an assistant professor of medicine at Rush University, where she continues to be an active member of the Committee of Admissions. And we're also joined by Trey Kwan. Trey is a revolutionary socialist, RN, student midwife, member of Left Voice, and member of the DSA Health Workers Collective. At the peak of the pandemic in New York City, she cut her maternity leave short to join her co-workers in the ICU. Once there, she co-organized a workers' committee to organize actions to defend patients' and workers' lives, joining a wave of opposition by rank and file nurses across the city. They not only fought for more PPE and testing, but also raised the call for a complete overhaul of capitalist healthcare for a nationalized system under worker control. And I'm your moderator, Natasha Lewis. I'm the co-editor of Dissent magazine. And I also just want to give a shout out to our latest issue, the fall issue, which has a special section on technology and the crisis of work. So relevant to what we're going to be discussing tonight. And it also has this beautiful illustration on the front cover of Shantonia Jackson, who's a certified nursing assistant in Illinois. And she talks about what her workplace was like during the pandemic. And it's a really fantastic interview. So I'd recommend everybody checking that out. Okay, introductions are done. I'm going to say a little bit about how we're going to run tonight's event, and then we're going to get into questions. So the first half, about 30 to 45 minutes, will be a discussion generated by questions I'm going to ask the panelists as a moderator. And then in the second half, the panelists will answer your questions. So please use the Q&A button at the bottom of your screen to ask questions, and you can use that Q&A button throughout the discussion. So, whenever you think of a question, just jot it down in there and we'll see it. And the chat box is separate from that, and that's for making comments to each other and asking technical or logistical questions. So we're going to close that now so we can focus on part one of the discussion, and the chat box will reopen for the Q&A. But in the meantime, if you have questions, please put them down in the Q&A box. And if you're on social media, I believe someone's monitoring Twitter as well, so you can put them down there as well. Okay, we're anxious to get to as many questions as possible. So let's get started. Right, to start with, I'd love to, if you could, each of our panelists could begin by describing what drew you to a democratic socialist analysis of healthcare and its relationship to racial justice. And Dorothy, if you could start us off, that would be wonderful. Thank you.
Sure. Thank you. So first, I'm just really thrilled to be here with everybody talking about this important subject, and I was honored to be able to contribute to the book. So I believe that healthcare is a human right. So its distribution can't be left to the market as it is in the United States. That privileges wealthy people who can afford the high cost of healthcare, who have employers who pay for it, and it leaves cash poor people and working class people with inadequate care. A capitalist healthcare system is antithetical to a radically egalitarian society because corporate executives will only provide as much care as is profitable. That's how capitalist healthcare works. So, healthcare is one of the basic human services that government should guarantee to everybody by providing it for free. To me, the Democratic Socialist platform calling for a single public universal system managed by the federal government, providing free, comprehensive health care on demand to everybody who wants it and needs it, is the best way to ensure that everybody has health care. So that's why I support that platform. Now, one of the reasons I'm committed to radical change in healthcare is because injustice in healthcare is one of the main manifestations of structural racism and white supremacy. It literally kills Black, Brown, and Indigenous people prematurely. But I also believe that America's legacy of white supremacy makes universal guaranteed medical insurance inadequate to dismantle the racist barriers to healthcare. I've spent a lot of time studying how institutionalized racism creates the unequal living conditions that are the main cause for health inequities in the United States and around the world. And so only an anti-racist approach to democratic socialist health policy can create the social and political conditions needed for health equity and the political conditions needed for radical change.
Fantastic. Thank you, Dorothy. Just to explain, I turned my video off because my audio was getting a bit weird. So this might be better, I hope. Okay, I want to pass it over to you, Susan.
Okay, thank you so much. And thank you for asking me to be a part of this panel. I think that, especially with the recent pandemic, healthcare has become an issue that is on everybody's front page. And it's something that needed to be addressed years and years ago. And I think now it's coming more and more to the forefront. But as a physician, I went to medical school with the plan to take care of Black patients. That was my goal. That was why I went there. And I decided I wanted to train at Cook County Hospital, which was then had a reputation of training over half of the physicians in the country at that time. And so I trained at Cook County, which actually functioned very similar to a single payer system. Everybody who went there was seen, regardless of whether you were insured or not, whether you had Medicaid, Medicare, or you were totally unfunded. It didn't matter. You were seen. And I think that even if you had $1 million in your pocket, there was really no way for Cook County to even bill you. I mean, we were, that was just not part of our infrastructure at the time. And that made it so much easier for me to be a physician, and especially to be the kind of physician that I wanted to be. I enjoy clinical work. I've never published a paper. I just never got into that, but I got into caring for people and being a clinician. And it was easy at county because you wrote a prescription, they went to the pharmacy, it was free. They needed a procedure, they needed a test, they needed surgery. You referred them to whoever did that, and it got done. Now, things may have taken a little bit longer, and there were hurdles, of course, but essentially, um, there wasn't all of this bureaucracy. There weren't all these hoops that we had to jump through to get people the care they needed. Um, yes, there was bias. There has always been bias, and there was bias at County Hospital. I won't lie about that. But for me, it just made it such a great place to train. And I feel bad for medical students coming out now, because they won't ever be able to practice in that kind of environment, and they're going to grow up with this they're going to grow up as physicians with this electronic medical record that is going to require that them to be looking at the computer screen instead of the patient that's in front of them, and it's not going to be as much fun, and I can expect that it probably may tarnish the medical care that we're able to deliver. So while I was at county in my early years, there were many people on the, especially in internal medicine, where the department that I trained, were involved in single payer. And Quentin Young was actually the ex-chair of the Department of Medicine. I rotated there as a senior student, and he retired after that. But so the roots of the single payer healthcare system in PNHP, of which I'm a part in, grew out, even though it started out in Massachusetts, it had some of its roots there in Chicago. So it's a personal issue for me. It's a social justice issue for me. And as a physician, it's an issue for me, because that's the best way to be able to practice healthcare, to deliver healthcare in a way that a physician would enjoy and their patients would appreciate. So that's how I got into this.
Thank you, Susan. And Trey, I want to hand it over to you. If you could answer that question as well, that would be great.
Sure, thank you, Natasha. I'm also really happy and honored to be here. Thank y'all so much for organizing this. So it's interesting, the question, democratic socialist analysis, in a lot of ways, first, I guess it depends on how you define democratic socialism. I think that socialism has become like a panacea if and for Trump definitely is the evil of all evils, but among friends and comrades, if so, democratic socialism means a society that is organized democratically by councils of the oppressed and the working class, that we can't arrive at through like incremental reforms or trying to play by the system's rules. Yes, that more than analysis, or I think a description of like how things are and what's wrong with capitalism, what really draws me to socialism are the strategy, the roadmap to liberation, and the road to basically overthrow of capitalism. And I think a lot of what Susan and Dorothy spoke to resonate with me. I think capitalism creates its own gravediggers. That's not my thought, that's what Marx famously said. The working class and all of us actually collectively have the power to make that kind of huge transformation that in a lot of ways like our planet depends on. But at the same time, I think something that is raised in this chapter is how the working class is also pitted against one another, and how racism is so integral to, well, the US capitalist system is built on racism, chattel slavery, settled colonialism, and the continuation of this biological myth of race. And, you know, for me, socialism is a kind of, how do we get out of this mess? And it's no mistake that I think that we shouldn't be surprised by the racist ramifications of the pandemic crisis, of the economic crisis, of our chronic housing crisis, but we should be enraged by that. And there's no other option but to really rethink control of our society, and it should be bottom up. And I mean, I guess more personally speaking, I'm a nurse. I don't feel an expert in my field at all. I think I'm very much at the beginning of, I guess, my work as a nurse. My mother was a nurse who immigrated to the US in the 70s. And I actually went into nursing not thinking that I could save many lives because I was already a socialist at the time, but thinking and still believing that, you know, the source of our power, of our strategic power, is as workers. Uh, um, I haven't published any papers either, and I don't think I will. I don't know, maybe at some point I will, but I think that our power really lies in organizing among the working class and oppressed. And I think we saw amazing examples of that this summer. So my hopes as a nurse was to be with the rank and file, to hopefully be part of a movement that can challenge the current direction of our unions and some of the problems in the working class, such as the barriers that were spoken to so well in that chapter of this internalized white supremacist ideology. And I think we're going to talk more about all those things as we continue.
Thanks so much, Trey. Okay, so the next question I'm going to ask is related to the essay, Dorothy's fantastic essay in the book. The first section of the essay is called "The Case for Universal Healthcare." So I want to ask you all to comment, and you can feel free to relate this to Dorothy's chapter or draw on your own experience. What is that case, and what do you think is the best way to make that case, especially in light of the recent election? And Susan, I'm going to hand that over to you first.
Okay, thank you. There's, you know, how we can get to a Medicare for all single payer system is difficult because of the way healthcare financing is structured. It is a for-profit system where the goal is not to take care of patients, but to make money. So knowing that not everybody has money, what is the point of providing care for everyone if they all can't pay you? So you've already got a system that, you know, isn't congruent with, you know, the structure of this country. One of the things that we do that we really need to stop is to couple health insurance to employment. Now, this started back in World War II when they needed more people to work the factories to make supplies for the war, and they couldn't increase wages by law, so they offered a benefit, which was health insurance. And this just fit in right into the structural racism of this country because Black people weren't getting those jobs. Actually, it was mostly white women because the men were fighting the war and it was white women who were left here. But the whole idea that it's coupled to insurance leads to inequity in itself, knowing that Black people have twice the unemployment rate in this country. And that's been historically the situation, that if it's tied to employment, they are going to be disenfranchised and not able to take care of this benefit. And then so many Black employees and people of color have jobs that are low wage, are essential workers who don't even provide a benefit. So even though they may be working in an essential job, they still don't get the benefit of healthcare. So the way the structure is set up, it was never made to be able to cover everybody. And also the fact that it's a for-profit system, resources are placed where they can make money and not where they can provide the care that is needed. Where I am at Stroger, within this Illinois Medical District, we call it, there's 4 large institutions and we all provide much of the same care. And even now there's a major hospital there that is building a new cancer treatment center, state of the art, that will be very lucrative, will make them a bunch of money, even though there's already 4 hospitals right in this square mile block that already take care of cancer. So why didn't they build a mental health institution there to provide mental health care for the area? Why? Because it doesn't make money. Why didn't they build a pediatric center where kids could come and get their school physicals and get immunized? There's a whole lot that they can do, but they end up doing what makes them money and not what the area right around this hospital is very poor, a lot of poverty, which is missing many resources, including another hospital within distance. So that we've got a system that cares to just a portion of the population, and that is by design. So in order to at least address the inequities that we see, we have to change the design of this so that we can provide care where it is needed to those who don't have it. Now, this is going to be difficult because if you look at, you know, how things are structured, poor communities have never had the resources. And one of the things I worry about with a single payer system, even if you provided resources where they're needed, they won't be funded the same as in white communities. And there was a study done that showed that hospitals in poor communities often lack resources. They often don't have all the same state of the art equipment. So anything based on money is going to be inequitable. So at least taking that part out of the equation will help. It will not solve it, and I'm totally aware of that. But we have to do something so that we can at least, you know, bring the resources there where they need it. Now, it won't eliminate physician bias. You know, there's a lot of things that will not be fixed just by providing access, because you still have to make sure the access is equitable and the access is unbiased and fair. So I think that we need this, and it's the best way. It's the first step in starting to equalize access to healthcare, but it's not the last step by no means. It's not going to solve the problem, and we still have a much longer way to go.
Thank you, Susan. Trey, I'd like to hand it over to you now.
Sure. Thank you, Susan, for that. That was great. So what the elections bring to light, or how do we think about universal healthcare in light of the elections? I mean, I think the elections this time around, as in the time before and the time before that, kind of affirmed that this undemocratic two-party political regime that all of us live under doesn't create real choices for people, that we have this choice to vote for who's going to continue to pass policies to maintain oppressive conditions, to maintain a mass racist incarceration system, to maintain the separation of families, this unequal and inherently racist healthcare system. Neither Biden nor Trump were for universal healthcare. In fact, they both did their best to show who was most against, you know, taking the market out of healthcare. They wanted to make sure not to scare their funding base, which is, you know, big capital. Neither of them were for defunding police, not surprising, which is, you know, of life and death consequences for Black people, for Indigenous people, for Latino folks in the US. So, and I think historically, like both the Democrats and Republicans have done everything to block universal health care or a public health option from passing, you know, through legislative means or through executive means, because it would, yeah, it would be a threat, or would be a blow to not only capitalist healthcare and those who directly benefit from the profits made off of exploiting us, the workers and the patients, but also, you know, having employment-based health insurance, which is such a, it shackles us because, for example, workers, when we were preparing to go on strike a year and a half ago, the first concern for workers was, what's going to happen with my health insurance? My child needs a treatment every week or every month. Who's going to pay for that? COBRA, $1,000 a month for working families, many nurses, many healthcare workers, many workers in general who have maybe one income to rely on. That is just impossible. So it's a great way to keep us from struggling, not only for better working conditions, but for maybe even greater political questions. Without a doubt, universal healthcare would strengthen us, would strengthen the working class to fight together, would also mitigate, as the chapter beautifully elaborated, some of the health inequities, not all. But what I think is, I would pose a question maybe a little differently, is not how do we make the case for universal health care, because actually the majority of Americans, Republican and Democratic voters, have been for universal health care for the last 60, 70 years. So the question is, what is in the way? And what resources do we need to mobilize among the working class and oppressed people who are most affected by this in order to achieve better healthcare system? And I think at least from, I guess, my experiences as a union worker, as a shop steward, as a rank and filer on the front lines, is that we have really important barriers in union leaderships who at best have put like kind of symbolic support to universal healthcare, like a statement here and there, signing on, hosting certain discussions or having events. But really, where is our power as a working class? It's not like signing our name to a piece of paper or even lobbying. It's throwing down, shutting it down, like taking to the streets. What really shook the country and what totally forced even Biden to kind of play up to the movement against racism was the movement in the street, was the demand of millions of people, particularly Black youth. So I think we need to think about how do we force the hand or our own organizations in the communities, in the neighborhoods, in our workplaces and schools to make this no longer an option that the two parties squabble over and kind of give, I don't know, play lip service to, every few years. Oh, and I don't want to, I'll end there because I don't want to go over too much.
Great, and Dorothy, if I could hand it to you.
Sure, that was great, Trey, that analysis of what we need. I almost feel like I don't have much more to say because I think she's right that we know that the system we have now hurts people, it bankrupts people. We have the worst healthcare outcomes in the so-called developed world, and we spend the most. So it's just obvious that the system we have now doesn't work. It only works for the corporations that are making money off of it. And so I think also with COVID, the fact that we have the most deaths of anywhere in the world also shows the total failure. I wonder if I should shut off my camera. I feel like there's a lot of, I'm gonna shut off my video. I feel like there's a lot of static. Should I turn my video off?
No, I think you're fine. I think it was just we needed.
Oh, okay. Okay. Well, so I was saying that I think just the experience, of the last few months with the US having the highest rate of deaths shows that our for-profit employer-based system of healthcare is a failure. And it hurts the most marginalized, disenfranchised people the most in this nation, but it's bad for everybody. And so there really is a strong case to be made that it just makes no sense to have a system that spends twice as much per capita on healthcare than in the EU, but we're far behind in life expectancy, infant and maternal mortality, chronic diseases, and just about every other key health outcome, with Black people, Indigenous people, and people of color having the worst outcomes. So we could also point out that it's the capitalist marketing of healthcare itself that spikes up the costs of healthcare and that fail to provide good care for everybody. I think we just have, there's an airtight case in support of a single payer, universal healthcare, whether it's from a human rights perspective. As I said, healthcare is a human right. And so it should be guaranteed, but also just from a common sense perspective as well. And so I think that Trey is right that what it is going to take then to get this system that we know is better, is more in line with human rights, and would produce more equal health outcomes and better health for everybody, is to demand it, to find ways in which we can increase our protests in support of it and demand it, because both the Democratic and Republican parties are not supporting it, and support instead, well, in fact, they are running as fast as they can from the idea of socialist medicine, despite the evidence that it would be better for everybody.
Thanks so much. I just want to remind people to drop your questions in the Q&A box. I'm going to ask 2 more questions and then we're going to open it up. Okay, Dorothy's chapter also makes the case that universal healthcare is necessary but not sufficient, given how institutionalized racism shapes medical care in terms of health inequities, unequal treatment, and the formidable barrier of racist resistance. DSA's Medicare for All committee notes that the fight for universal healthcare must incorporate fighting the health impacts of racialized capitalism. Why and how must these fights be intertwined? And Trey, I want to hand this one over to you first.
Sure. I think not a lot of folks who are outside of New York know about this struggle, but I hope people get to know about this struggle ongoing. There's a hospital called Kingsbrook in East New York, in Flatbush, Brooklyn, that is a small community hospital, a few hundred beds, that serves primarily Black and Brown immigrant patients. And the workers there come from the community. They're fighting closure. Mind you, as New York City coronavirus levels are on the rise again, in the middle of a pandemic crisis, where all we hear now are shortage of beds, shortage of personnel, shortage of medical equipment and trained people. We need more care, not less. And not to say that this is anything new. New York City, real estate, finance capital, Cuomo, they've all been in lockstep to close down these plenty of community hospitals, especially in communities of color, over 20 in the last 15 years. And this is happening though now, so it really exposes how absolutely inhumane the capitalist logic is. And the important thing is that the workers at the hospital are fighting to keep the hospital open, not to save their jobs, because they're being guaranteed jobs at another facility as a kind of crumbs being thrown at the workers. They're fighting to keep those services in a Black community. So how is, fighting for healthcare, fighting for universal access related to the fight against racism? It's inseparable. Basically, when you fight racism and you're also demanding that our lives and our health be taken out of commodity production, those are both two-pronged attacks against the interests of the capitalist class. They don't want us to be doing that. They especially don't want us to be getting together as Asian, Black, Latino, white, working class people to fight for those interests. The workers are fighting to keep the hospital open, and they're asking for solidarity. now. And I think that pointing to those types of struggles are really important examples, because it's not just a policy fix, a policy that would be really important to pass, but that I think a lot of us are real with ourselves and each other, that the Dems and Republicans will not be passing universal health option anytime soon in the absence of a major, forcing of hand. And that's going to be, kind of what we saw this summer, but involving working class organizations. You can't stay on the margins while we let the people who are most affected by racism fight for us. That is unacceptable. We need to be calling and going on strike and defending our hospitals and making sure that healthcare is accessible to people, in particularly communities of color. I think that the way these fights are intertwined, really like thinking about our long-term goal, or our main goal, is we want to win reforms that ameliorate the brutalities of our everyday life under capitalism, but we also want to keep in mind that our goal is eliminating class society, because if that's at the root, if that's what's generating and breeding and maintaining, racism, if that's what is maintaining this merger and closure of hospitals, then we need to get to the root. Class exploitation is what generates poverty, and it what is strengthened by the internalized white supremacist logic and benefiting to a minority of working class people in the US at this point. So it's gonna take some offending of the bourgeoisie, of the ruling class. Is gonna take more than passing, symbolic statements, and actually putting at risk, even the union's hold on health insurance. So it's probably an bit of an existential crisis for unions, who for the most part have not been at the forefront for universal healthcare, which is just a damn shame. Something that is going to help working class people, their families, and patients, that we don't have unions really fighting for this. It's because they want to defend this idea that, well, we have something to offer our members. If we don't have health insurance to offer our members, then who's going to want to join a union? Well, that's why we can't rely on people who have this business-minded idea of working class organizations. That has to be about like rank and file, and a lot of these initiatives, both for universal healthcare, for kicking cops out of our union, for taking to the street and having direct solidarity against police brutality, that's being done by rank and file folks. And that's probably why, because it's not in our interest in the long run as a whole to keep the system as it is.
Thanks, Trey. Okay, I'm going to ask my last question now. So make sure you're putting down your questions in the Q&A box, because we're going to be coming to those soon. Okay, what are some of the key components of an anti-racist democratic socialist health policy? Dorothy's chapter discusses the importance of a movement based on a model of freedom as a matter of social justice rather than individual choice, as in the example that she uses, the women of color-led transformation of the March for Freedom of Choice into the March for Women's Lives, and structural competency as part of medical school training. DSA's Medicare for All committee, in collaboration with the Social Medicine Consortium's Campaign Against Racism, calls for cities to declare racism a public health crisis. How might these and other components of a policy be put into action? Okay, Dorothy, I want to hand this over to you first.
Okay, so, and picking up on the last question as well, I think that it's important to recognize that although DSA recognizes that health is social and it's included fighting the health impacts of racialized capitalism, the policy prescriptions that concentrate on providing medical services for all don't address the structures that produce poor health and unequal health in the first place. So I think what's important is that part of the platform and part of what we're fighting for, a central aspect of it, is abolishing the structures like prisons and police and surveillance and unequal incomes, unequal wealth, unequal schools. You know, I could go on and on, the structures that produce more death and illness in marginalized communities. That's what the focus has to be on. I'm not saying that providing government funded, provided single payer, universal health care isn't equally important. They have to be intertwined. They have to be fought for together with a recognition that there are institutions and structures and systems that are producing poor health in the first place that need to be abolished. So I think fighting for abolishing prisons, police, surveillance, and fighting for universal health care is one movement that has to be fought at the same time. And the more that we can understand that and strategize about that kind of broader based movement, the more we'll be able to achieve both dismantling the structures that produce poor health and at the same time advocate more strongly and have a better chance of achieving the universal government provided healthcare that right now is not part of the mainstream platforms at all.
Thank you, Dorothy. And sorry for moving on too quickly before you got the chance to answer the previous question. But thank you for bringing that in. Susan, I want to hand it over to you now. And also feel free to get back to the previous question about how these fights must be intertwined as well.
Yes, we can't look at these issues just individually, as Dorothy said. I mean, they are all part of this soup that has created this mess. And I think one of the biggest pieces of, or one of the biggest tools that this country uses is segregation. And if we look at segregated communities that have been, started since Reconstruction ended, and even in the North, they existed even when Blacks were not slaves. They were still relegated to certain areas where they could live in the North. But what segregation has done is it has isolated all these groups, and it has also made it easier for those areas to be policed and surveilled, like Dorothy said. Once you have them in an enclosed area, you can keep track of what they're doing and what they're not doing. And so by doing that, one of the things that segregation does is that it provides data, and it justifies that it justifies its continuation, because there's no interaction. And so people don't know any different than what they see on the news or whatever. And that, oh yeah, they need to be kept over there. They need to be separated. And so that's almost the core. And so what happens is there's not any communication. And so it just creates a group that justifies their superiority, their sense of entitlement, and their white supremacy. And I think that one of the things that happens is that even white people who are living in poverty, who do need health care, who are going without, they're mad at the wrong person. you know, they're angry at Black people because they may get something, rather than understanding that it's this corporation, this structural racism that is also preventing them from getting health care because they don't have money. And so, you know, it's the adage that I'm sure you've heard, that even the poorest white person would not want to be a Black person who was wealthy. And so it's this differences in these racial differences that have been created and sustained with the structure have continued this inequity. And along with this segregation, we have all these other things that come along with it. The poor education, there's no transportation to jobs, there's no grocery stores. We close hospitals in those areas. And keep in mind too, a hospital isn't just an institution to deliver medical care, it's a source for jobs. That's where people in neighborhoods work. Doctors come to work in a neighborhood that has a hospital. So it's beyond, it's part of the economic structure. It's not just an institution that provides a service. It does more for that community. And that's being eliminated in these communities too, with these closures. So it is all intertwined. I'm not sure how to kill this white supremacist beast. I really don't know how to kill it, but that's at the core of all this. And unless we can get past this sense of entitlement and get out of this zero sum, because what people don't need to understand is that this is something that we all need, and that a single payer system doesn't give more to some and less to others. It gives the same to everybody, and it would be equitable to everybody, and it would be acceptable to even those who feel most entitled, so that they would not be losing out on anything that they think that they are entitled to. And even if you look at how, one of the things we do is we rank hospitals. We say, what's a good hospital? What's a poor hospital? And it's really a reflection of the patient population. Because if I see patients at Cook County who may not be able to eat well, so they come back with their diabetes uncontrolled, or they come back with their heart failure that's exacerbated, and that's not because of the care they got, it's because of the social determinants of health that make it more difficult for them to maintain their health. So we have to approach all of these, and like Dorothy was saying, it's all part of the same mess, and just fixing one, although I think if you are healthy, you're better able to address some other issues in your life, but you still have to address all of it to get the most benefit. And people who are without, who still have the sense of superiority, will never live to their fullest either. And they have to acknowledge that.
Thank you so much, Susan. I think we're going to move to audience questions because we have a bunch coming in, and I want to make time for as many as we can. So I'm going to start with a couple of questions, two at once, and then if you want to kind of jump in on either question that appeals to you, that's great. So first question is, I learned from a recent PNHP meeting that the US is failing to meet its own goal for recruiting, training, and employing Black, Indigenous, people of color in healthcare provider positions. How do we support and raise up more BIPOC to the healthcare profession, especially as providers like doctors, so that our healthcare providers are more representative of the US population as a whole? And then the other question I want to pose to the panelists is, can universal coverage be achieved through a public option? What are the pros and cons of the public option? So would anyone like to jump in first on either one of those questions?
I'll make a comment about the public option, is that the public option still has all the bad things we don't want. It is still based on private health insurance. It's still going to it will not address the costs. It will not control costs. We still have all the high overhead and the high administrative costs within that system. And its goal is not to provide universal care. So it's just a sort of like a buffer. It's not really getting closer to the goal, and it's not really adequately addressing the people who need coverage, who don't have it. And what I will say too is about increasing the numbers of minority providers. This country has never wanted to do that. If you look back in the early 1900s, there were 10 medical schools. And then there came out a report funded by Carnegie and the AMA and reported by this guy Flexner. And what they did was they closed all the Black medical schools except for 2. They kept Howard and Meharry. And this was during the time when there was an medical education was by an apprenticeship. And then it began to change into more structured with 2 years of basic science and then clinical work. But Black schools did not have the funding sources for that. All of them were private. None of them were state sponsored. None of them have government funds like the white medical schools. And so we had more Black physicians then in the early 1900s in terms of a percentage than what we have today. My medical school class in 1979 had more Black men in that class than we had Black women. And you won't find that today. And part of that is that the pipeline for Black men is being destroyed with mass incarceration and just the surveillance and criminalization of Black men's behavior. It's destroying this pipeline. So that's a symptom of the inequities down the line, and that you can't get people to the end point if you take them out of the game on their struggle to get there. And that's what is happening. It's not that there's not an interest. It's not that people don't want to do that, but the numbers are people are being pulled out. And so they're not even getting to the chance to become a physician because of all of the structural racism that interferes with their journey there.
Thanks so much, Susan. Dorothy or Trey, would you like to jump in?
Well, I would just also support bringing more nurses and midwives into the healthcare professions and supporting them as well. I agree with Susan that a big reason why there are so few Black and Indigenous and people of color in these professions is because of affirmative ways that they're kept out, and then also the lack of financial support, which is related to the need for universal higher education as well. So that is part of what we need to be fighting for. And I just agree that a public option is not, it's just an option. It doesn't fundamentally change the reliance on for-profit corporations and employer-based insurance as the way of providing healthcare. It has to be a universal single-payer system that provides free, on-demand healthcare for everybody, and that's not what a public option is.
Thank you, Dorothy. Trey, would you like to weigh in?
Sure. I wanted to maybe revisit this idea of the public health. So racism is a public health crisis as a statement or kind of a banner being flown today in light of the George Floyd uprising. And I kind of want to push back on or dialogue with that idea of a campaign or that idea of, you know, sticking with that as an action to express, you know, anti-racist solidarity. First, because in general, I think statements or symbolic, you know, phrases just aren't enough, right? I think we all know that, and not to defeat the idea. I think the fact that the recognition of racism as systemic, as structural, in a broader section of the working class, of health professionals, of folks in general, is a positive sign. It's a movement forward. At the same time, I think, you know, hiring of more people of color to positions like MD, attending, program directors, or department heads, sensitivity and implicit bias trainings. I think that these will not address, obviously, the problems that capitalism engineers and the crisis that capitalism engineers. And I think a major problem with that term is that it kind of obfuscates who benefits from white supremacy and racism, and who holds on to those even tiny crumbs of privilege and step up. And we have to really confront racism within the working class. And like as a nurse, and I think trying to speak to the question being less general, as a nurse, there are many nurses, there are many healthcare workers who see cops as natural allies, as people who are in the trenches with us, public servants. Recently in my union in NYSNA, there was a resolution passed by nurses, primarily white, who said we need to strengthen our alliance with cops. Clearly a reaction to the anti-cop movement, because people are beginning to really understand, or have known for a really long time, depending on your own historical experiences with police brutality and racism, that the police are there to harass, to brutalize, and to maintain the mass incarceration of people of color and poor white people and homeless folks. So I think that there's this reaction to a movement that is progressive, that is bringing people together, that is multiracial, but it's a reaction that is a kind of defense of what little we have. And we, in our unions, with our coworkers, we really need to fight that instinct, that impulse. We need to, root out those ideas, really point out how, hey, it's not in our interest. Who are you identifying with when we see cops beating up activists, people who are on their picket lines, Black people, Black youth, trans folks, disabled people? Like, why don't you have a visceral reaction when you see that? And what is it but racism? What is it but internalized racism or rejection of, or anti-Black racism? So I think the campaign that a lot of union rank and file folks, from the Writers Guild to SEIU, to kick cops out of our unions, I think the importance of that is that it's an ideological struggle. It is a fight to say who is our enemy and who are we going to be as a class? Are we going to be upholding the idea of white is right, we want to maintain our privileges as white folks, or are we going to really be, in the interest of all of the working class to end capitalist exploitation? And so that kind of a campaign, I think, is really important. And the people who are most against it are people in union leadership who want to maintain the declining dues paying base, including police union members. So that is something that is not my interest. That's not something that I want to hold on to. So we should take, the example of the MLK Council in Seattle. And then another thing I wanted to raise was, the idea that racism is a public health crisis. It kind of makes those people who experience racism seem like they are the victims, they're the object of racism, and who is perpetrating racism. We're not really going to talk about it. We're not really going to talk about the system. I think it's a little bit too up in the air. I think that the idea that we should strike against police terror. I think the idea even of abolish the police. These are more potent. Cops out of our schools, cops out of our hospitals. a little more specific and kind of points to the need for action on the part of working people. There's a really important example I wanted to point to in 2010. A student, a Trotskyist here in Argentina, where I'm living now, is Mariano Ferreira, was shot and killed by actually union bureaucracy hired thugs. Here, the union bureaucracy literally kills dissidents in South America, in many countries here. So the way that working folks in Neuquén responded to that murder was the subway workers in Neuquén went on strike. Within hours that Mariano Ferreira was killed, they went on strike. They closed down the subways. And imagine if in the US, where police kill 1,000 people a year, where every time that happens in New York City, in Philly, in Seattle, and Portland, these Democratic run cities, let's say we don't go and ask the city council anymore. Let's say we go on strike and shut it down. Do you think there's going to be an option for them, whether or not we will continue to funnel billions of dollars into police instead of education, instead of healthcare, instead of food and secure housing? I don't think so.
If I could just say, make a point that, Trey, you reminded me of, we've been talking about universal health care and its relationship to white supremacy and racism. And I don't think we've touched on enough something that Trey was raising, which is the way in which the medical profession has supported white supremacy and racism, and the way in which it has been a policing institution. So it's not just about doctors finding alliance with police. Structurally, the medical practice has aligned with police as a profession. It just as an example, turning in patients to child welfare authorities and prosecutors for using drugs while pregnant. That's just one example where the profession has been a tool of the government. And so that's another way in which policing and medicine have been aligned, but also a way that something we have to contest. And another example of how providing healthcare by itself doesn't necessarily undo the structures of racism and white supremacy that we need to undo. So I just wanted to add that aspect of this discussion.
Yes, thanks so much. Susan, would you like to say anything on that issue?
No, I think I made my comments before. It's, I think it's just also intertwined, but I think Dorothy's comment about how physicians contribute to the white supremacy aspect of this industry is true and quite valid.
Thank you. Okay, I'm going to read another audience question. Now's kind of last call, I think, for audience questions. So if you've got them, put them in now so we can get them in before 9:30. Okay, so someone makes a very good point that single-payer national healthcare is an existential crisis for the entire for-profit healthcare insurance industry. How do we fight against the trillion-dollar industry with the capability of spending many billions annually on lobbying alone? And I'm going to ask one more question. So in the introduction to Dorothy's essay, she notes that the US is the only developed country relying on a private for-profit insurance system to fund and deliver medical care, which makes us out of step with a model of healthcare motivated by egalitarian principles. How and why did this happen this way in this country? And why is the system being challenged at this moment more than ever before? Dorothy, would you like to begin since we're bringing in your chapter again there?
Well, I think Again, this goes to white supremacy and racial capitalism. To me, the reason why we have such an abominable healthcare system in the United States and general social welfare system in the US, whether we're talking about healthcare or education or income support or wages, housing, unhoused people, and on and on and on. The US is just abominable, whether we're comparing it to other nations or to any sense of humanity and human rights and meeting people's needs. And why is that? I think the central reason for it is the investment in whiteness and the lure of white supremacy that divides the working class. That's the only explanation I see for why it is that in the United States, a tiny, wealthy elite dominated by white men can create a system that is so unhealthy for everybody. And so I think that's another reason why we have to be anti-racist and have a much stronger unified movement to have not only universal health care, but also to dismantle prisons and police and all the other systems that are creating the inhumanity and suffering in this nation. I can't remember what the first question was. I think that was the second question. I may have forgotten.
That was the second question. The first question was about the kind of billions that the healthcare insurance industry is spending on lobbying and how we overcome that.
Well, it's not by counter lobbying. Not by counter lobbying. But I will let my co-panelists talk more about what the kind of movement it's going to take that's not about spending billions of dollars on lobbying people in Congress, because that clearly hasn't worked either.
Yeah, I mean, you need massive campaign reform, because that's what happens is that, before, going to Congress or getting into government was sort of looked at, this is public service to your country. Now it's a career like anything else, and you do whatever you can do to keep your job. And a friend of mine who worked with Harold Washington administration, she had done a lot with politics and all, and she was just talking about these politicians that she had just seen over the years before Harold Washington. But she was saying, you have to remember that those people can't do anything else. So they have to keep that job. They can't do anything, or they don't have the skills. So that it becomes, this is what you do to stay there. And so this is the system that they have created with this lobbying, and it keeps funneling money. And even if you look at how both Republicans and Democrats, they require candidates or people who are in office to raise enough money to give to the National Republican or the National Democratic Party. And if you look at a lot of Black candidates, they come from communities that are not necessarily wealthy. And so the amount of money that they have to raise in order to give to the national parties is phenomenal, and it can't all come from their communities because they're not wealthy enough. So that this is structural racism. It's created a system where a lot of these politicians, who I think hearts are in the right places, but in order for them to stay there, they become beholden to these lobbyists. And it's an awful system that really never should have been allowed. The whole idea that we can have PACs never should have been allowed. And it's just destroyed the whole purpose of elections. And it's become, we can see now, I don't know how some of these people got reelected. I really do not. And it's clearly, you know, anything white is better.
Thanks, Susan. Trey, do you want to weigh in?
Sure. I want to, I guess, speak to, I think the other question that was raised, or this, we're talking a lot about the very real forces, the very real ideas and structures that keep us divided, particularly racism. I also think that there have been really important historical examples and recent examples of how those ideologies break down at very important moments. And I think most important moments have been in struggle. So we have historical examples in the US of abolitionists, white working class abolitionists with African-American slaves, with people who have a common interest ultimately in doing away with, you know, an oppressive system, though very different experiences. And I think we see those examples in the labor movement. We see that people can change. People can actually change and overcome or do away with racist notions. So what we need to do is drive forward, support and highlight those examples. I think about a Black midwife, Asma Gabre in San Francisco, who went on strike saying, I'm not going to work in this hospital, San Francisco General Hospital, until all of the sheriffs are out, because sheriffs perpetuate racist violence against the patients, against me. And I refuse to work in the hospital when we don't, that is not how you provide security. What happened? Nurses in the ED and a lot of workers in that hospital actually counter-organized against it. So we really, I think a really important thing to focus is how do we create unity among ourselves, not by stepping around racism, not by trying to point to those fights and reforms that will, you know, resolve racism indirectly in a roundabout way. And I think I've heard some people talk about universal healthcare in that way, but actually hitting at it and being very direct, like frontally and directly rooting out racism in the working class in order for us to better, you know, improve our own working conditions, lives, and chances at saving our planet, basically. I think, you know, there is hope, and the hope is not about getting along necessarily. It's actually really about politically struggling, that our workplaces are not neutral ground. The medical system is not neutral territory. It's not about how we can move up in the ladder. It's about how we confront these dimensions of racism in our workplaces by mobilizing, by challenging the leaderships. And it's really hard, obviously very, very hard on a personal level, individual level to fight these battles at the workplace. There's retaliation, there's, you know, isolation and being kind of stigmatized. And I think that's why I think having support of people like that midwife in San Francisco is so important. But I think the more that we move forward and see that capitalism cannot fix its problems, that capitalism will not eliminate racism because it's interested in the perpetuation of racism, we will see that there will be more struggles, there will be more fights within the working class led by Black people and people of color. So I actually don't think, I really think that these struggles for Black lives is a spark for a broader revolutionary movement to transform our society. I think it's very important that we see how central the fight against racism is to our health in a broader sense, as Dorothy is talking about, not just, how do we tie that in to our pitch for a particular, bill or policy, even if we acknowledge that those, programmatic changes to healthcare system are very helpful, we have to think also beyond that.
Thank you. Okay, I'm going to ask a final couple questions, and I'd love if you could kind of wrap up in that moment because we've got about 10 minutes left. Okay, so this is building on comments. This is from the audience, building on comments that Susan made about white supremacy and Trey made about kind of workers being in different places politically. And this question is kind of, how do we bring people on board with the ideas that you've been discussing tonight, who might be kind of scared of socialism or, have fears about different ideas? How do we kind of, bring people along and persuade them that, this is the way? And related to that, I was curious, Dorothy, since this book came out in January, and this has obviously been a huge year for healthcare, what do you think has changed since you wrote this chapter?
Well, one thing that's changed is the coronavirus pandemic. And as I was saying earlier, to me, it is an absolute condemnation, indictment of our for-profit-based healthcare system, because it failed completely to keep people healthy and to provide what people needed to avoid getting sick and to be treated if they got sick. It also shows what we've been talking about in this whole program, the deep entanglement of structural inequities, like structural racism, that dramatically shape the experience of the pandemic with, Black people and Indigenous people, especially being hit the hardest by it for structural reasons. It also exposed this continuing debate, which I believe Susan brought up, this idea that the reasons for health inequities stem from some innate biological differences, especially racial differences that's still deeply held in the practice of medicine today and by the general public. And debates about that still circulated, but the higher rates of illness and death in marginalized communities is a strong testament to the way in which structural inequalities produce these inequities in health, and why we have to not just provide universal healthcare for everyone, which we must do as a human right and as part of a humane society, but we also have to dismantle the structures that are producing bad health for everybody, poor health for everybody, but especially death and disease for the people who are most marginalized by racial capitalism.
I mean, this country was built on white supremacy and racial inequality, and just in terms of healthcare. Back in 1899, W.B. Du Bois wrote The Philadelphia Negro, and he showed, I don't know how he did it back then with just pencil and paper, but he showed then that it was really the social determinants of health that explain the inordinate impact on TB of TB on the Black community in Philadelphia. So this has been known. This isn't something that just popped up in the computer age. We have known this. And so what has happened over the next 150 years almost is that the mechanisms to maintain this structure have changed, but the structure is still there. And I mean, it's like with segregation, you know, you can't put a sign up and says, I won't sell to Blacks, but you make exclusionary zoning. You do other things that allow you to keep a neighborhood segregated. So it keeps the structure more invisible, and it just changes the mechanism to maintain that structure. So this is not something that can be, you know, just taken apart easily. This is a massive fundamental change of how this country was built and what it was built on. God, I sound like such a pessimist, I know, but it's
No, I don't think it's, the thing though is, and I think this is part of what Trey was saying, and she can have the last word on this, is that recognizing the way in which racism and white supremacy have thwarted the strength of movements, people's movements for radical change, is a way to end that, and there are examples throughout US history of people moving together across different kinds of divisions and coming together to make change. But we have to recognize the strength of these deeply embedded ideas about human difference and the invention of race as a way to divide working class people in order to support the wealthiest. And that's what we have to continue to struggle against. But I believe that we can do it. I mean, I think that's what gives me hope to keep fighting. It is possible. These divisions, you know, one thing about recognizing our common humanity and that race is an invented category that was invented to support racial capitalism is that we can imagine something different and better and more humane and equal and just. We're not chained to our biological destinies. That was a myth that was created to prevent change. And once we recognize that and imagine a different world, we can work together to create it. And so, you know, I think that's optimistic.
Yes. Thank you.
Yeah, thank you, Dorothy, for leaving us with some hopeful thoughts. Trey, would you like to say some words before we wrap up?
Sure, I thought that was really beautifully put. Thank you both. Just hearing and learning from you and your experiences. So I think very early on, I guess as a nurse or just working in different places, it's hard to believe that I can make much of a difference at bedside, caring for patients as an individual. But I do think it matters that those of us who work in healthcare, that we challenge ourselves to listen, particularly to Black patients, Indigenous patients, non-English speaking folks, to really listen. So literally walking to the room and observing and asking questions. And I think that is not a practice that's so basic, right? But it really doesn't happen. If you observe any unit in a busy hospital, and I think that what is so basic yet terrible and about capitalism is that, like, our healing capacities, our work, our art is not ours. You know, our intellectual work is not fully ours. And, you know, Elon Musk said we can coup wherever we want. And he's very openly speaking for himself and for his class. And it's true that the political regime serves people like him, billionaires, the capitalists. But what about us? Why do we not recognize the power we have? And why can we not claim our own healing power, capacity, intellectual abilities, collective abilities? I think that is fundamental to socialism, is actually the wealth of collective capacity, power, and ability that this system will not do justice to. So I also, you know, wanted to raise how the elections, you know, this time last year, the DSA and many folks on the left were putting their all and a lot of hopes and a lot of excitement around the Bernie Sanders campaign. It was really important that he raised and popularized, ostensibly or arguably popularized, the idea of Medicare for all in a broader public, which is definitely progress. But we also saw that he totally ended up, you know, backing Biden and not openly, you know, indicting the Biden campaign in any way for dismissing all of those more progressive ideas or that platform. And it was kind of like this moment where the handing over of, okay, I'm going to back you and I'm going to like make sure that, you know, I'll work with you on your campaign and your platform. But what actually came out of that was we got really pulled to the right in terms of the whole national discussion on what are the options, what can we fight for, what can we imagine for ourselves. So I think that's not like Bernie Sanders' fault per se. That is the way that, you know, bourgeois elections operate. You know, it reduces, you know, our possibilities of even what we can talk about. Even in the left, we kind of can, you know, really start taking these different moral high grounds, or like, you know, blaming each other for, well, if you don't vote for Biden, then you're a Trump supporter, or if, you know. So I think that a lot of those conversations really limit a serious discussion of strategy of how we will get there. And I do think, however, that if we look at not only the history of, you know, white supremacy and how it's operated to maintain racism and capitalism, but also the two parties, the Dixiecrats, the Dixiecrat Democrats in the South, you know, the whole way the Electoral College was built on the notion that Black people were literally less than white people, literally a fraction of white people. So how do we do politics and organize in a way that is a constant indictment of this political system that is inherently racist and undemocratic, that we need our own organizations, that we need our own parties. We can't rely on the capitalist parties.
Thanks so much. I'm afraid our time is up. I'd like to thank everyone who was involved in bringing this event together, our panelists, Dorothy Roberts, Susan Rogers, and Trey Kwan, everyone who came tonight and asked amazing questions. You'll be receiving emails about upcoming events and telling you how to buy the book, and so you can read Dorothy's great chapter and subscribe to Dissent and other things. I also want to give a shout out to a number of people who've been working behind the scenes on this event. Sunshine, Royani and Ludda, Michael Bennett, David Duhalde, and Priscilla Yavarino from the Democratic Socialist of America Fund, Emily Janakaram from the New Press, and Flynn Murray from Dissent magazine. Okay, thanks so much and good night.